Continued increase in hospitalizations. The governor announcing additional resources for medical facilities today. Our Jay Burr was at the weekly press conference and joins us with more on what changes the governor is making. Jay?
That's right, Laura. He hit on that. He also hit on a myriad of other topics, and especially this week before the Christmas holiday, officials just encouraging Arkansans to just use caution going into this holiday because the state is also going to be practicing more caution with the issuance of a new directive. Governor Asa Hutchinson issued a new directive on Tuesday. This new one says that indoor events with more than 10 people in attendance has to be approved by the Department of Health. The governor emphasizes it is not a ban on indoor events.
It just simply means you have to have a good plan approved by the Department of Health to make sure it's safe and that you have your distancing, you have your mask requirements, and the other things that are necessary.
Things that already have separate mandates like restaurant capacity and sporting events will not be subject to this new directive that runs from January 2nd to March 1st. When asked if the governor plans on issuing further restrictions in light of recent increases in numbers,
we have all kinds of mandates and restrictions that are in place.
Baptist Health will expand their bed capacity by 124 and include ICU capabilities on their Little Rock and Van Buren campuses. The project is estimated to cost $7.4 million, but the state is hoping that 80% will be covered by FEMA.
We have to be ready for whatever comes in January. It is my hope that we will build this out and we will not have to utilize those beds for COVID patients.
Right now, the state is just immunizing frontline health care workers and long-term health care workers and patients. The discussion is ongoing as to what essential personnel will be in line next to receive the vaccine. The CDC listed several industries, but also said they can be adjusted to meet the needs of states.
I want to have Dr. Delahaye and a vaccine committee listen to and have that considered by all the impacted populations in Arkansas so they can comment on it as well.
Now, Governor Hutchinson said he also expects around 40,000 doses of vaccine to be delivered to the state by next week. And Baptist also expects that their Little Rock build-out of that alternative care site could take about 4 weeks, at least, like I said here, the one in Little Rock, and that the spot in Van Buren, about 6 to 8 weeks. But they do say that if there is a need that arises, that some of those beds need to be used before they are done with those projects, that they can accommodate any of those patients. Live in Little Rock, Jay Burr, KRK 4 News.
Jay, thank you.